Injuries are a common part of life, and while we often realize that physical trauma can change how our body functions, we often forget that they can change how our brain functions as well. Physical injuries can arise from unpleasant or even traumatic experiences and can leave us with mental health battles involving anxiety, acute stress, post-traumatic stress, and depression. So in this episode, we're going over some common mental health issues that can arise after injury and what can be done to ensure you not only take care of your body, but your brain as well. Because the fact of the matter is that a strong body is nothing without a strong mind to control it. So let's get after it. All right, everyone, welcome back to another episode on the Strength Resurgence podcast. This is episode number 6, where we're talking all about mental health after physical injury. And there's a lot of great stuff to talk about in this episode, so I'm pretty excited to get into it here. I appreciate you joining me. And just real quick, as we get going, just want to say thank you for being here. There's absolutely no shortage of podcasts out there to listen to, and it always just means a lot to me when I think about others spending time with me in this podcast. So if you haven't met me before, my name's Jim. I'm a physical therapist, a strength and conditioning specialist, and just someone who's super geeky with what it is that I do, helping others, basically what I call learn the science and art of coming back stronger from injuries. And that's what this whole podcast is about. If it's your first time tuning in, I talk all about things that, are related to pain and injuries, and we're exploring the life-enhancing effects that can be gained as we work to write our comeback story. And we all need to be geek about something, so that's why I got this podcast going. So as we get going here, I always like to start out just with a fun little quick fact about who I am, something kind of outside of the nature of this podcast. Because I just want you to feel like you're spending time with another human being, another dude. And that's who I am. I'm just like you, right? So fun little fact about me. I might have a slight coffee addiction, but I'm at least I'm at the point where I can admit it. First step is always being able to admit that you got a little coffee addiction. So I'm kind of a coffee snob now too, I guess, just because you start to kind of know what good coffee tastes like. And it's not even just coffee. It's just finding good cafes and shops around town. Where I work, there's just a great little coffee shop that opened up in downtown Calgary, right across the street from where I'm often spending time helping other people. A little place called Semantics Coffee Shop. So great people, great little atmosphere. So that's been my recent discovery. Good coffee, good atmosphere, good people running the joint. So that's a fun little fact about me. So what are we going to get at in this episode now that we're going to get into the meat and potatoes of what we're talking about? Well, today we're talking about mental health issues that can arise after physical injury. Pretty important thing to talk about, because I think we always acknowledge the importance of rehabbing the body after a physical injury, but we don't necessarily always acknowledge that sometimes you need to rehabilitate the brain too. Different types of injuries can be very traumatic, can cause all sorts of fears and just some distress in the mind, in the brain. And that's an important thing to talk about. And so I thought I'd make for just a good podcast episode where we can really kind of explore the nature of this to one extent. And as we get going here, let's just quickly talk about what we'll run through in this episode, and then we'll take it from there. So naturally, we're going to talk about the mental impact of physical injury and pain. We all know that there's a physical, pain component, but emotional or psychological pain is another one. And I see that quite often in the clinic with certain injuries. So I'll share some anecdotal experiences around that as well. And then we'll talk about something called the pathoanatomical health model, where we're going to look at the nature of the body and the brain having to heal up from an actual kind of physical perspective. But there's another model that we're going to then talk about as well that helps us to take into account just the other psychological and emotional issues that can come along after physical injury. And that's going to be tying into something that we call the biopsychosocial health model. Sounds like a fancy schmancy term, but we'll break it down. It's pretty straightforward, actually. So we will get into that, and then from there, we'll start to open up on the common mental health issues that can arise after injury. Some interesting stats that I'll bring forward from a paper that I was looking at that talks about the percentages of these types of mental health struggles that we can find ourselves facing after we've had some type of injury, a sudden traumatic one, or even the emotional impact of chronic pain that doesn't seem to go away, pain that just seems to linger and just kind of grinds you down and wears you down as you try and just live your life, and finding that this pain is unrelenting and it won't go away. So acute pain, chronic pain, it all kind of adds up in its own unique way for a lot of people sometimes. So we'll definitely get into that. And then that'll kind of lead into the concept of what I call feeling stranded on injury island, as if you're the only person going through it. And maybe you don't think people can relate to you, or other people just quite identify with what you're struggling with, and how much of an isolating feeling that can be. Like you're injured and on that island all by yourself. So we'll get into that. And then we're going to work into a concept called the fear avoidance model of chronic pain. Some interesting things to look at with how chronic pain just almost creates a vicious cycle in making life harder for us to get out of pain sometimes. So we'll definitely need to talk about that and look at that. And then we'll talk about the power of community, so that we have some strategies around remembering we're not alone, and there's other people out there who can help, not just from the physical rehabilitation standpoint, but from the mental, emotional standpoint as well. It's a very important thing to get at. And then we'll really get into kind of, where are we going with all this in terms of talking about mental tactics that we can use for better outcomes, which will help with the body, but also help with the mind, right? That psychological component as well, and even the spiritual component as well. I think that's some important stuff that we'll need to address. So as we get going here, I just wanted to start out with a quote that I heard some years ago that I thought was a really powerful one. It always stuck with me, and definitely wanted to share it with anyone listening who, whether you're injured or not, I think this is an important one to hear and to keep in mind as you go forward with your own challenges in life. And the quote says, "Ask for help, not because you are weak, but because you want to remain strong." I think that's a very powerful quote, and one that's grounded in a very healthy way of looking at struggle, where we're all going through stuff. And if we can ask for help with the mindset of knowing help is going to keep us strong, it's going to help strengthen us, I think that's a powerful mindset, rather than, hey, I'm going to ask for help because I'm weak. Now, it's not to say that you shouldn't acknowledge that you feel weak or anything of the sort, but sometimes just framing things in different ways through different angles, I think can make for a powerful impact on how we perceive the nature of our condition and where we're at. So ask for help, not because you are weak, but because you want to remain strong. So here's the problem to solve that we'll kind of open up this episode with, and then go from there. So we know that the mental toll of physical injuries can be just as devastating and painful as the physical issue itself. It's not to say that this happens to everyone who has any type of injury, but it does for a lot of people. And the stats are pretty clear on that, and we'll get to those in a little bit. And so really we then have to ask the question, how do we combat the psychological impact of physical injuries and conditions in a manner that doesn't necessarily downplay their significance, but doesn't give them the upper hand either? So in other words, we can't pretend like we don't have a problem, but we can't just stare at that problem and not find ways to move forward. So I think we need to be very honest with ourselves in how we approach these situations and navigate these conditions that we might find ourselves in. And that's the nature of this whole podcast episode. So we will definitely get into that. So in other words, what we're really trying to ask here is, how do we acknowledge what we're up against, but honor the importance of fighting back? How do you acknowledge and balance that tension between knowing that there's a real issue at hand, but also looking for the way out at the same time? I don't personally necessarily think it's healthy to only acknowledge that there's a problem without looking for the solution. But at the same time, if we pretend that there's no problem and everything's sunshine and rainbows when it's not, I don't think that's necessarily healthy either. My understanding is there's some research out there that actually backs that up, that we need to acknowledge what we're up against. And it's not healthy to pretend like things are fine when we know that they're not. I was reading a book a while ago. I'm not quite through it, but it's called Cleaning Up Your Mental Mess. It's by Dr. Caroline Leaf, and really cool book. She's a kind of a PhD neuro kind of biology researcher who looks at a lot of that stuff, and really cool book. I'm no stranger to having anxiety and all sorts of other mental health struggles throughout my own life as well. And I found that to be a pretty good book so far. And it's just very validating to know that we need to give ourselves space to honor what we're up against and not just pretend like it doesn't exist. So as we open this up here, as we talk about kind of, the impact of our mental health after some type of traumatic or even non-traumatic physical injury, I just want to acknowledge that, I have no idea what you might personally be up against in your own life right now. You create a podcast that you're kind of putting out there for literally anyone in the world to listen to. And you have to acknowledge when you do that everyone from all walks of life is going to be perhaps tuning in. And maybe you're listening right now from a hospital bed after, some type of unexpected injury or circumstance. Or maybe you're just listening to this while you're working out in the gym with a minorly sore knee or a moderately sore elbow. I need to acknowledge as we go open up in this episode that everyone is in a different spot in life. And I don't want to be downplaying what anyone's up against here. So wherever you're at, I want you to take whatever you want from this episode and run with it. And if I say anything that doesn't resonate, then simply drop it and pretend like I didn't say it, and then just carry on from there. I hope that sounds fair enough for everyone. So when we're talking about this problem to solve and mental health impacts, mental health issues after either acute or chronic injuries, just some of the main ones that we can list off real quick. Anxiety is a big one, right? And that kind of feeling of unease and kind of thinking forward into the future about unfavorable things happening. Again, I'm no stranger to anxiety at all. We'll talk also about acute stress disorder, ASD, as it's abbreviated. Acute stress disorder has been found to be quite a common thing after some type of acute and chronic injury. And we'll talk about post-traumatic stress disorder, PTSD. I think a lot of people are familiar with what that's about. That's one that definitely needs to be addressed after any type of event that leaves us feeling psychologically unwell, because that tends to really just linger around and not necessarily resolve itself until we have someone who can help us work through that. And then just one more common mental health condition that can arise after injury, whether acute or chronic, is depression. Right? I often think about, I've certainly seen a lot, people who have had chronic pain that's relentless and ongoing for a long period of time. I see that in the clinic quite a bit. And chronic pain, it's absolutely exhausting. And that's one of those things where it just grinds you down and it wears you down. And we need to make sure we have some strategies in place for dealing with that. So those are kind of really the problems that we got to solve here. So as we do that, just to give you another quote to start kind of mentally chewing on and kind of essentially framing this whole entire episode that you're going to be listening to. I came across this quote a while ago, and I really I felt like it hit me pretty good. It was one of those ones where I almost felt like it called me out a little bit, and I said, yeah, I definitely got some stuff to work on. And so the quote is, "You can go to the gym, drink your water, and take your vitamins, but if you don't deal with the stuff going on in your heart and your head, you're still going to be unhealthy." Now, I replaced the word stuff from another word that was originally used in the quote, and just trying to kind of keep this a little bit more wide audience friendly with kind of changing out some language. Not that I don't like some of the language that was used, but again, just trying to keep this worded in a more friendly manner for anyone who wants to be listening. But that quote, as far as I know, comes from an Instagram page that I came across and started following called All Around Business. I really liked that quote because, man, I think there's so much truth to that, right? It doesn't matter how healthy your diet is or whether you're getting your 150 minutes of zone 2 aerobic conditioning every week. I mean, that's good, but as I kind of said at the start of the episode, a strong body is nothing without a strong mind to control it. So that's just a quote to chew on as we kind of get into all this that we can kind of frame this up with. So if we look at kind of the big takeaway of what we're going to get at with this episode and what I hope you're going to walk away from or walk away with is, first of all, that we're all human. So with that being said, that means, as far as I'm concerned, you need to give yourself permission to acknowledge how you're feeling when you're going through challenging times from pain and from injury. I think that's kind of step number one, is we need to interpret and feel for ourselves what we're up against and then openly acknowledge it. And when I say openly, I don't mean, to necessarily everyone else, not to the whole entire world. I think there's certain people we do need to share that vulnerability with, but just when I say openly, just to yourself, honor the fact that you're human and humans have limits. And when we get tested and pushed to our limits, we need to acknowledge that that's a tough thing to deal with. So that's, one of the big takeaways. Just give yourself space throughout the process of rehabbing, not just your body from an injury, but your mind as well, right? Now, the second takeaway is that there can be profound power in remembering that you're not alone. And so that's an important one I feel to remember, because humans do better when connected through community. Personally, I don't believe that we are, as a species, meant to take on everything by ourselves. I don't think that's healthy ultimately. There's times where we need to process things for ourselves and spend some time by ourselves. Lord knows that that's something that I do quite a bit, but that I myself am actually quite guilty of kind of doing more of that than I should for longer periods of time than I should, so that things ultimately start to work against me. Made that mistake quite a bit, and to be honest, I still do. But we need to remember that getting plugged in with community is a very, very powerful and wise step, and a wise thing we need to do as we're trying to keep ourselves mentally healthy and strengthen ourselves, not just in body, and not even just with our mind as well, but even our spirit, right? I think that's a very important thing. And then the other big takeaway is that you need to know that your worth and your value as a human being never changes despite your physical condition or situation. I sure hope, if nothing else, that's the biggest takeaway. Just because you're having a hard time getting through something, it doesn't detract from your God-given worth of who you are and your value and what you can offer to others around you, and the ways that you can enrich this world or enrich someone's individual world. So I think, if nothing else, that's the big takeaway, is that it's okay to struggle. It's okay to fight. It's okay to feel, all these emotions that we have to tackle when we're coming back from a physical injury. But you need to know that it doesn't change your value of who you are. Not in the slightest. It never has. It never will. So please keep that at the forefront of your mind and thoughts as you go through whatever it is you might be going through. Okay. So a brief reminder here, just as we keep unpacking a few things. I am not a mental health therapist, and nothing in this podcast episode or in any episode is medical advice, not anything for mental health advice, not even for physical advice. I'm a licensed physical therapist, but I'm not your physical therapist. So please just keep all that in mind. Now, you can chat with maybe the concepts of what's covered in these episodes with other people who are qualified, who are directly working with you. But please remember, I'm not a mental health therapist, and I'm not claiming to be one by any means, just sharing what I believe that is stuff that's important that we need to acknowledge and keep at the forefront of our minds. Now, that being said, part of my job when I'm working in the clinic, especially as a physical therapist, involves helping my patients get plugged into other appropriate allied healthcare professionals. I do that all the time, whether it's with psychologists and other mental health counselors, or other medical professionals based on what a patient is dealing with. It's very what we call collaborative approach, and it's a very important thing to do. So as you're going through your own injuries, don't think it's strange if you have to get plugged into a mental health counselor or any other professionals as you go along. That's a common thing, right? Okay. And then just again, kind of we've said this before, but your physical outcomes of what we achieve with our body doesn't really mean much if our mental health remains an absolute wreck. So maybe you get injured and you feel like you make a great physical recovery, but you're falling apart at the seams internally, either just kind of concealing it to yourself and trying to put on a mask and actually kind of carry forward and present that kind of bold personality, whether you're presenting that way or you're having a hard time leaving the house because you're so scared about crossing the street because you have those flashbacks of getting hit by a car or being in a car crash, which that's common stuff that patients tell me all the time as well. So point being, we got to get strong physically, absolutely, but we got to get our mind strong as well. So let's look at some different health models here real quick when we're kind of talking about pain and injuries and these dysfunctions. Because again, there's a couple different ways that we can look at this, or different lenses that we can look at and evaluate all this through. So different models of health exist, with each model attempting to explain causes of disease and injury. And so there's two main ones that we're going to talk about here, as I alluded to at the start of the episode. The main models that we're going to look at from a kind of disease and injury standpoint here, there's one called the pathoanatomical model. And that's the one that I think most people are familiar with. Hey, I have pain in my arm because I broke my arm. This physical structure is causing this specific type of pain. These are the signs and symptoms. So the symptoms are kind of what I'm feeling or what I'm perceiving. And the signs would be what someone can outwardly observe, someone who's evaluating you. I think we're most in a Western society often familiar with that model. A very valid and important model, absolutely. And then there's another model out there that I think makes sense to a lot of people, but we just sometimes don't look at injury and kind of issues that we might incur with our bodies. We don't look at it through the second model as much, which is called the biopsychosocial model. And I think especially when it comes to mental health, we really need to kind of consider that second model, that biopsychosocial model, especially if we're going to be talking about the impacts of what can happen to our brain and our emotional health following a physical injury. And so I think you'll understand a bit more in a moment what I'm getting at with that. So let's talk about the pathoanatomical model for starters, the one that most people are familiar with. The pathoanatomical model just focuses on identifying specific tissue damage causing an individual's symptoms. So patho for pathology. So pathology is what has gone wrong, what isn't right, what is the underlying issue, and then anatomical, kind of pertaining to the body and the relationship between the pathology or the issue and how it affects the body. So an example, if we were going to look at this pathoanatomical model, if we had an example of lower back pain, well, we often find, especially if you're like an orthopedic physical therapist like me, that people can have lower back pain for a multitude of reasons. A common one would be due to a mechanical issue in the back, such as a bulging disc. So the discs are like the little kind of rubber hockey pucks that sit in between each vertebra bone. They're pieces of cartilage that help to kind of provide structural stability and kind of pressure distribution and absorption in the back. So if someone has a bulging disc, that can cause pain. That is the structure that's causing pain. You can have pain in your back because there's a degeneration of the spine, whether it's the disc degenerating and flattening out, or the facet joints, which is where the little joints from one vertebra link up to the other, become arthritic. We can get conditions called stenosis, where there's kind of all this extra bone buildup and breakdown of some of that cartilage of the joints, and it can lead to issues like radicular pain, where you get the nerve root that's coming out of the spinal cord, and that becomes irritated from the stenosis. And then you have this called radicular pain or sciatica, pain running down the back of your leg. So that's a common example we see a lot if we're looking at the pathoanatomical model of pain and dysfunction in the body. Okay, but then we have the biopsychosocial model. And this model, despite it having a kind of funky sounding name, really, it's pretty straightforward when we break it down. So the biopsychosocial model acknowledges the interplay between biology, so the tissues and other kind of physical components within our body, nerves, muscles, joints, tendons, those types of common tissues. So it acknowledges the interplay between biology, but also psychology and social factors. So all three of those, bio, psycho, social, all those factors, and it recognizes illness not purely as a physical pathology. So not just a structural hardware issue in the body, but it's looking at kind of the greater scope of things. So an example could be that someone has that chronic lower back pain, which has physical factors that cause pain. So we talked about that disc bulge, stenosis of the spine. But then this model, in addition to that, it also considers psychological factors, such as, fear avoidance beliefs. So how we find ourselves wanting to maybe avoid movement or activities because of our beliefs about fear becoming worse or making an issue in our body worse. And it also considers social support factors. So someone might have back pain, but do they have a social network, social support factors, and coping mechanisms that they can use to help offset a lot of the issue that they're currently up against? So very kind of broad, but very important lens to look at a lot of these injuries and conditions through. So that is the biopsychosocial model. And so if we start to think about common things that a physical therapist like myself will run into, it can be a lot. And it's important for anyone who wants to be a physical therapist that your job is to not just see people through their physical issues, but also acknowledge that they're often, depending on what they're going through, they're going to be carrying some psychological stuff into the sessions as well. Now, that we're not licensed to directly treat those issues, but we certainly need to be aware that they exist because it can help. It can help in a couple different ways. I think a big one is just giving our patients grace, right? Just realizing that they're going through some tough stuff right now, and just simply being mindful of that, I think, is a very important thing for building a better therapeutic alliance and letting that patient know that we still support them. So I've seen it so many times in my career already of meeting a patient for the first time and working through the initial evaluation, learning about what's bringing them in for the clinic, and the patient just absolutely breaking down in tears when trying to describe the details of the motor vehicle accident that they were in, 1 or 2 weeks ago. I've seen that quite a bit. I've seen, kind of young women really have a hard time opening up about that. I've seen big, tough, strong dudes break down in front of me because of the mind having to mentally stare at and recall the issue as they're working to tell me, hey, this was the nature of the car crash. Here's what happened. That can be traumatizing in its own right, to kind of have to focus on that and stare at that as they're trying to tell me what happened. Okay, well, I was just going through a green light and then someone T-boned me. They weren't paying attention, ran the red light. And that's some pretty yucky stuff to have to mentally stare at. So I see that quite a bit. It's not uncommon that people break down in front of me. And then, it's also not uncommon for patients to, cry or try and fight back tears when I'm examining and touching a fully healed scar from a traumatic injury, even if that scar is healed up and the injury was 10 or 15 years ago. I've had a handful of times where someone's coming in and maybe they got knee pain or ankle pain, and I look, I'm kind of doing my standard evaluation, and I see a scar on their leg, and I say, hey, are you okay if I just kind of feel the texture of the scar and evaluate it? Because I can actually learn a lot about some tissue factors that might be going on based on the mobility of the scar and a few other things. And I'll gently start to kind of touch and move the scar. And I'll have people who start to cry. And I've had times where people say, I don't know why I'm crying. I'm really sorry that I'm crying. I have no idea why I'm crying. And I'll think in my head, well, that's okay. I likely know why you're crying. And you get to know them more and work with them a bit more. And you find that there was a lot of trauma around how they got that scar. And you start to bring the mind's eye back to that region of the body. And you can absolutely have some powerful emotions kind of flood your brain. So I've seen that a few times for sure. And then, I've also had it where I've seen patients kind of have emotional outbursts from maybe feelings of helplessness and frustration due to their injuries. And again, as a physical therapist, what I have to do is learn not to take any of that personally, because sometimes you're seeing people at their worst and they're having a hard time, and we need to give them grace when it comes to that. And those emotional outbursts, they're never directed at you, right? It's all about that helplessness and frustration, likely due to their injuries and how maybe they feel that injury has robbed them from what they want to be doing and experiencing in life. And, I know people, they just say, I just want my life back. I just want this pain to go away. And okay, that tells me that there's certainly a physical pain going on. It also tells me that there's a mental rehab component that needs to likely be worked through as well. So there's a couple of phrases that I've learned over the years that I quite like, and I'll sometimes share with my patients when we're going through all this. And so one is that pain is limbic. I can't remember where I heard that one. I think I heard it in a course I took years ago. But pain is limbic. And so limbic refers to the limbic system. And the limbic system is a group of brain structures that regulates your emotions, your memories, and your behaviors. And it's essentially your emotional nervous system. And that's just something I got from online for a nice summary from the Cleveland Clinic about summing up the limbic system. And so pain is very limbic. There is a very emotional kind of component, I think we all know and understand, that really factors into kind of a lot of these painful injuries or conditions we might find ourselves up against. Another one, again, I heard years ago, I can't quite remember where, but it's that pain has memory. And so our brain, it's always concerned with protecting ourselves, and it remembers pain and unpleasant experiences to protect us from future hurt. So, when we're talking about this, ultimately physical pain can be a very emotional experience, and we need to leave space for this when considering physical rehabilitation. There's often times that it's going to feel overwhelming for a patient, and that's perfectly fine. I think it's fine to feel overwhelmed. I don't think that gives us license to just give up all hope and not find ways to improve ourselves. And at the same time, I think for a rehabilitation specialist like myself, I need to remember that I need to help other people and kind of be aware of how they're feeling so that they can then start to kind of know that there's other actions that they can take to get themselves aligned better mentally and emotionally and even spiritually as well. So, okay, so let's define traumatic injury here real quick, because a lot of what we're talking about pertains to traumatic injury and what a lot of these stats are going to look at from a paper I'll cite here in a moment. So the definition of traumatic injury, we're going to say, is a sudden, serious physical injury, often requiring immediate medical attention, caused by an external force, like a car accident or violence. So that's how we're going to frame up traumatic injury. We could absolutely kind of expand that definition a bit, but for this podcast episode, I think that will work quite well. And again, that definition just comes from the Cleveland Clinic. Nice summary that I pulled up online. Let's talk about a definition for chronic injury real quick. We're going to define that as an injury that gradually develops over time, often due to overuse or repetitive strain or repetitive use or poor technique. So unlike acute traumatic injury that came on suddenly, we're now talking about something that kind of gradually develops over a different period of time. And so when we talk about chronic pain, we're going to say that this is pain that has persisted for more than 3 months. So if it's before 3 months, we'll call it acute or subacute, depending on where in those 3 months we are. There are some models that say that chronic pain should be more defined as not 3 months, but 6 months. Again, we're splitting hairs at that point, but for this episode, we'll say chronic pain is anything that's lasted and persisted for longer than 3 months. So let's look at some of the research real quick here. I pulled up a great article I read through a little while ago, and the article is by Wiseman, Kim Foster, and Kate Curtis, and the name of the article is Mental Health Following Traumatic Physical Injury, an Integrative Literature Review. Pretty kind of interesting stats that they found in this, and I think it's a good article, but let's always keep in mind that this is only one article, so we don't necessarily want to just draw everything from it, but it's a pretty good article to look at for what we need to consider here. So with post-traumatic stress disorder, as we kind of get into what this paper found, let's just quickly define post-traumatic stress disorder. So PTSD is what we abbreviate it as. PTSD is defined as a state of anxiety following either a physical or psychological traumatic incident and includes symptoms of extreme fear, anxiety, helplessness, recurring memories of the preceding incident, which may result in avoidance of people, places, or objects associated with that event. So that comes from the paper that I just referenced there a minute ago. That was their definition. This is arguably the most common one that I see in the clinic. I mean, obviously, I'm not trained up on how to really look for the nuances of certain behaviors and mentalities, but just kind of seeing the big glaringly obvious things that I see a lot. PTSD is definitely a big one. Most often see it where I kind of practice right now with car crash or motor vehicle accident, which we abbreviate MVA. A lot of MVA scenarios can be pretty traumatizing for people, especially when they have to rehash the details to me. It's a pretty common one that I see. So in this article that we're referencing here, they found that the incidence of PTSD after a traumatic injury ranged between 30 to 93%. Now that's quite the spread, okay, 30 to 93%. And they kind of came across these numbers based on other articles and papers and things that they were looking at. And I think it misses the point if we say, well, that's just such a big spread. I think the takeaway really needs to be that, well, if the lowest would be 30, then even at the absolute lowest, that's essentially 1 out of every 3 people is going to have some form of this PTSD, which is a persistent issue that certainly needs to be addressed. I think off the top of my head, as I kind of think about this with motor vehicle accidents, again, the ones that kind of leave people really banged up, I'd say it's, I'm probably detecting at least half of my patients have some form of it, whether they openly kind of tell me or I kind of see things that maybe I feel, I think they're struggling with this. So whether it's 30%, whether it's 93%, or anything in between, I think the takeaway is that it's not uncommon. I think that's a big takeaway. And PTSD can be pretty troubling since it's very persistent. So in this paper, basically another takeaway to think of is that, this is a real thing. And if you have it, hopefully this would bring you some relief in knowing that, maybe 1 out of every 3 people are going to have some type of PTSD after a traumatic injury. So right away, if you're feeling that you have, kind of troubling, persistent thoughts, and are kind of having, fear, these kind of avoidance of people and places or objects that are associated with your injury, you're certainly not alone. That's a very important one that I want to address, right? You are not alone. So in order to kind of make this diagnosis of PTSD, by the way, they said within this article that the symptoms must be present for at least 30 days before you could actually make the diagnosis. So 1 month. And again, that's tough when you've already gone 30 days and you're still having these troubling thoughts, and this stuff can persist for years, man. So you got to look after yourself and be brave enough to take action and have someone help you out with it. So the next one in this paper that we'll talk about for some of the stats is what we call acute stress disorder, or ASD. So in this article, they defined acute stress disorder as an anxiety disorder, and similar to PTSD, is characterized by symptoms of fear, anxiety, and helplessness, and distressing memories following a physical or psychological traumatic event. So it sounds very similar to PTSD. And this is where it was found in that article that this acute stress disorder, which would basically be kind of a shorter-lived version of this stress before it turned into post-traumatic stress disorder, as far as my understanding is that this was found to be in the range of 23 to 45% of all individuals after a traumatic injury. So somewhere between 1 out of every 4 to 1 out of every 2 people have some form of the acute stress disorder following a traumatic injury. So again, if you're finding that you just got out of had an injury happen and you're feeling not mentally well and having some troubling thoughts and you're feeling distressed, okay, that's either 1 out of every 4, 1 out of every 2 people, 1 out of every 3 people, somewhere in that range are experiencing those same issues that you are. So hopefully we're building up a case here. This is common stuff. It affects so many people. And if you feel like you're one of them, you're certainly not alone. Very important thing that I want you to be aware of, and that I try and make my patients aware of too. And this acute stress disorder can be diagnosed as early as 2 days following symptoms. Now, I can't diagnose that. Again, really only a qualified mental health therapist could. But again, this is kind of the brand new part of the distressing thoughts before they go on for a month or longer. Now, another one we'll talk about that they found in this paper was anxiety. And they said that anxiety is basically something that's characterized by excessive worry or fixation on events that has preceded the symptoms. And so in this paper, they found that the incidence of anxiety in a review of the studies they looked at ranged from 16 to 40%. Now, this anxiety included general anxiety disorder, driving phobias, so fearful of driving if maybe you had a car crash, and travel anxiety as well. So 16 to 40%, just kind of having that excessive worry or fixation on an event that has preceded the symptoms. Okay, so that's certainly something that is likely going to affect a lot of people, where whether it's 16% or 40% or anywhere in between, point being, pretty common stuff. And so I think we're building a case that the mind can certainly be fragile in a lot of ways. Because again, my limited understanding of psychology is that the brain is always trying to look out for you and protect you. And so it's not going to remember the good stuff nearly as much as remember the bad stuff, because it's trying to protect you. And this is where it's pretty easy for our thoughts to get dysregulated in our moods and kind of have these kind of mental disorders that we now have to work through. So now the studies have found that anxiety has negative effects on physical health. So that's an important thing, right? So we had a mental health issue and it adversely affects our physical health. And they found that that includes increasing pain, so increasing our perceptions of physical pain, increases our fatigue, decreases our physical function, so we have poor physical function, and overall reduces our quality of life. So I think we're building a strong case here again to think about the importance of rehabilitating the brain, or the mind, I should say, so that we're actually getting better physical outcomes as well. So my job, I help people with the physical issues, but I need to make sure, and you need to make sure, that the mind is being addressed as well if there's any type of troubling thoughts. And it's not to say that everyone's going to get this stuff. I get a lot of patients who come in, and from what I can tell and what they tell me, they're doing just fine. And that's great. It's certainly what we want. But we know that that's not everyone. So we need to be realistic about what can be expected after some of these physical injuries and issues. And then another one they looked at in the paper was depression. I think we're certainly all familiar with depression. In the paper, they defined it as a mood disorder that was affecting up to 25% of the general population and is characterized by feelings of ongoing despondent mood, disinterest in general areas of life, and continual feelings of loss and helplessness. Now, in the paper itself, depression was found to be present in 28 to 42% of survivors of traumatic physical injury. But it was worth noting that they pointed out in the study that depression, throughout all the papers they looked at, was not studied nearly as extensively as PTSD. So they mentioned that the research was still a bit limiting here. But it makes sense. If you have pain, you have troubling thoughts, you're having issues carrying on with your life in the way that you want to, it's certainly going to be depressing in some capacity, right? Whether it's because the physical pain is wearing you down, or you feel your life has been taken away from you, slowly getting stripped away from you because your fear is causing you to avoid lifestyle factors and activities that you want to partake in, but maybe you're scared to do so or have too much anxiety with. So I think we can all see how that would lead to depression. So you're not alone if this is something that you're going through. Lord knows, even with some injuries I've had in the past, which are minor compared to what so many people have gone through. But yeah, absolutely. Injuries have affected me just simply because I'm an active guy. I want to be active. I want to do what I can. And when I can't partake in those activities I want, especially for a couple of weeks or longer, it's not a fun spot to be. So as I stand here kind of talking and delivering this podcast, I want to be very clear that I understand a lot of this. And in no way am I going to compare myself to just some of the horrendous stuff that people have had to rehab through. But we're all human. And so as I stand here, I don't want to come across as someone who is trying to lecture in a way where I'm saying, hey, this is all that it takes. And, I have all the answers, because I certainly don't. I still struggle with a lot of the stuff with my own injuries as well. So we're all in this together, kind of going back to some of the big takeaways we talked about at the start of this episode. So what now? Now that we know how common some of these mental health issues can be following an injury, what do we do with these stats, right? It's one thing to know them, but if we don't know how to apply them and turn them into something that can benefit us, then I don't really know if we've really accomplished anything. So a quote that I came across it, I think, in a forum online years ago, as we kind of frame up what we're going to do now. Well, the quote is that as human beings, our greatest survival skill is the ability to ask for help. Which, if you let that sink in for a minute, is pretty profound, because are there other species out there that we know of that can directly ask for help? I mean, at least in terms of kind of how I perceive this to play out, no. I mean, I think us humans have a unique advantage of doing that. So maybe that's the starting point with knowing all these stats and issues. It starts by asking for help. And again, not because we're weak, but because we want to remain strong. Remember, that's how we need to frame this up here. So the initial steps to take, at least how I would look at this, would be, first of all, to acknowledge how you're feeling. If you've had a traumatic injury or you have a chronic injury that's kind of grinding you down and wearing you down, no matter what the kind of nature of the injury was, acknowledge how you're feeling is likely an important thing to do. And if you just try and ignore how you're feeling or pretend that you're fine, it's likely not very healthy for our mind and for our body. Again, this goes back to some of the neuropsychology research that Dr. Caroline Leaf has done. A lot of great studies in her book that I was reading through, again, Cleaning Up Your Mental Mess. Really, really cool research that showed that when we just kind of deny how we're feeling, well, everything's fine, everything's good, when you honestly for yourself know that it's not, I think it's damaging in a lot of ways. Messes with our mind, might mess with our body as well too. So initial step, acknowledge how you're feeling. Give yourself space, process it a bit. Take some time if you need to kind of get yourself oriented with how you're feeling and where you feel you're at. And then probably the next step would be to reach out to someone. And who this is going to depend on so many factors, but whether it's a friend or a family member, a mental health therapist, a counselor, or a pastor, anyone who you feel you're comfortable discussing with how you're feeling, that's likely a very profound starting point to take. I can't tell you who to reach out to. I don't know who you are. I don't know what your situations are, but reaching out to someone that you confide in person or online, if it has to be, whatever it is, It's likely a next good healthy step to take. And then as you do that, remember that you're not alone. You're certainly not the only one going through this. Just rifling through those stats a few minutes ago should help, hopefully make that abundantly clear in one capacity or another. And so there's strength in numbers. And the stats clearly show that many people who experience traumatic injury feel the same way. And I think that can be a very relieving thing and a very powerful thought to kind of keep at the center of your physical and mental recovery is, cool, I'm not the only one going through this. And I think if you can keep that thought in mind, it's not the only thought to keep in mind, but I think it helps to kind of ground us in remembering that we're all humans and other people out there understand this and get this. And certainly other people out there are cheering for you and rooting for you and want you to get better. And, I'm certainly one of them. And so that's an important thing, because when we talk about this concept that I often call injury island, where whether it's acute or chronic injury, it can often make us feel like we've been left behind. So you start missing out on life experiences, time with others, doing activities you want to partake in. It can absolutely make us feel like we're stranded with nowhere to go, basically like we've been left behind, or we're stranded on an island. This is especially true if a bunch of your friends went for a big long hike or did this big activity that you wanted to partake in and you just couldn't. Your body wouldn't allow you. It's a tough spot to be in. And if you feel like you're the only one out there in the world who is in this situation, that's going to be pretty defeating and maybe overpowering. So you're not the only one on this injury island. There's other people as well. And whether, again, it's acute pain, that can be very troubling and very debilitating. And then that chronic pain standpoint as well. It's often exhausting. It's kind of that death by 1,000 cuts, just mentally wearing you down just one day after another. It's exhausting. I see that all the time with patients in the clinic. That's how they describe it. That's how it absolutely looks when I see people going through chronic, awful pain. It wears you down. And, if you kind of keep all this to yourself and you don't remember that there's steps that you can take to start getting yourself moving forward, well, it feels like nobody understands, right? Oh, no one gets it. No one understands what I'm going through. Now, I think our problems are all unique in our own ways, kind of like fingerprints are on our fingers. We all have fingerprints, but our own individual fingerprints are unique. But if you have an injury or condition and it has a name, well, then what that means is that someone else has had it before you. So you're certainly not alone. So you got fibromyalgia, right? This central sensitization where your nervous system is ramping up pain signals and just anywhere you touch in the body hurts like crazy and it's exhausting you and everything else. It's got a name, right? And other people have had it as well. And that's one of those things where people out there absolutely understand. You got to find the right people, talk with them. I got an episode coming up where we're going to be talking about the wounded healer. So people who use their pain and injuries and become uniquely qualified to help others. We're going to get into that in a future episode. That's an important thing. But if we're not addressing all this, and we go back to the mental health issues, how they can persist and spiral out of control, it starts to screw up again the physical recovery from a standpoint of having a harder time getting better, particularly with one of the many things that we'll talk about is through an issue called kinesiophobia. So kinesiophobia is the fear of movement, and it's often with the underlying belief that movement will make our pain worse, right? So kind of our belief system here. And again, it's common enough that it has a name. So if you're fearful of movement because you think movement's going to cause your injury or your pain to get worse, you're certainly not the first person to deal with it. Now, the problem is that the fear of movement can create a vicious cycle, causing things to become worse, either mentally or physically, right? So we got to be careful because this vicious cycle can perpetuate and get out of control pretty quick. So if I have someone who I think is experiencing kinesiophobia, as I get to know them, work with them more, I need to try and educate them in a way to help them understand a few things. So the first one is that not all hurt is harmful. Now we have to distinguish between what is appropriate pain and discomfort and what isn't. But sometimes physical pain or discomfort throughout that physical recovery process is actually a good sign. It can be a very telling sign that things are getting better or moving in the right direction. And when you help people understand that, you can start to break that vicious cycle of being fearful of movement. If you don't move enough, tissues can decondition and things can become more painful in that regard. You have less of a buffer against physical movement and activity. So we got to break that cycle. Now, again, it's important to understand that we're not saying that all hurt is harmful or all pain is harmful. But again, with the certain conditions or issues that someone is up against, when I've evaluated them in the clinic, discomfort or unpleasant sensations are actually just such a good sign. And it's very empowering when patients learn some of that. So I want to make it clear that not all hurt is harmful. And again, if you're fearful of movement, that creates new problems physically and mentally. And that's not going to help us get out of this, situation that we're in. So if we look at injury, when a physical injury happens, there's kind of a normal cycle that we can go through or an abnormal cycle that we can go through. And the abnormal cycle is the vicious cycle. So what normally would happen is that if you had an injury, okay, well, you might have some fear around moving, maybe no fear, but some type of fear would be healthy because again, you got to be mindful of what's just happened. But then you go, okay, I've got pain, I've had an injury, I'm a little bit kind of apprehensive of what's going on. So let's confront it. Let's do something about it. I'll get someone to evaluate it, show me how I can take care of the issues. You work through that, you confront the issue, and then you're off to recovery, and then you're good to go. So that's the normal progression. Now, in the case of kinesiophobia, what happens is you get injury, and then as you are kind of processing your injury, what happens is we start to what we call catastrophize our pain. So catastrophizing refers to always thinking about the worst possible outcome, the worst possible case scenario. And so we catastrophize about our pain. Okay, well, if I do this, then this awful thing is going to happen with my body. It's going to become incredibly painful. The worst thing that's going to happen, that could happen, is going to happen. And so what does that do? Well, that makes us fearful of movement. And then if we're fearful of movement, we're going to be fearful of re-injury. And then so what do? So we avoid activity. We become hyper vigilant around any type of physical activity or movement that would likely be okay to do, or maybe we need to be mindful about, but we just outright avoid it. And because we do that, we get disuse of the body. So the body deconditions. It has less of a buffer to tolerate physical movement and activities. And that leads to further disability. And then you feel like your life is getting stripped away from you. That leads to depression. And okay, I'm depressed. And oh, well, if I do this is going to get worse. And again, the vicious cycle just goes on and on. And that's kinesiophobia in a nutshell. And so we need to break out of that. And the right professionals can help you with that, depending on what you're up against. But essentially, this is all a concept of fear avoidance. Okay, so fear avoidance. What we're going to say is that it's essentially what it sounds like, right? We are going to try and avoid, in this case, activities or movements because we believe that pain is going to be present and make everything worse. So up on the screen right now, I've just got a model that kind of diagrams that, where I've kind of got this kind of bullseye looking target. And it's not mine. It's just, it's a common illustration for the fear avoidance model of chronic pain. And we got pain at the center, but then radiating outwards, we got all the mental health kind of issues that take place. So we've got pain catastrophizing. And then because we got pain catastrophizing, the thoughts of our pain getting worse, we become very fearful of pain. And we kind of become fearful of pain. So we limit our physical activity. We get physical deconditioning, right? And this is just like, it's just kind of one layer after another building upon itself. So you get pain, you get the negative effect of pain, you get the emotional response, and you get the avoidant behaviors associated with that, and you get your disability. So chronic pain, we often see this quite a bit. Vicious cycle, we got to break out of it. So how do we do that? Well, again, not a mental health therapist, so I don't know all the possible avenues to take, right? But one of the things that we know from a research standpoint is that the psychological concept of cognitive behavioral therapy, CBT, it's frequently used to treat pain-related functional disabilities. So this could be something that people look into if they want to become less fearful of movement and better understand, again, how their mental health can improve their thoughts and beliefs around moving more to improve their quality of life. So the definition of cognitive behavioral therapy is a skills-based intervention that emphasizes identifying and challenging maladaptive cognitions, emotions, and behaviors. So that comes from an article by Houghton in 2016. And this is done with a mental health therapist, a licensed psychologist or clinical practitioner who can set you up on this course of action. Now, when we use this with the fear avoidance model, cognitive behavioral therapy targets the harmful effects of pain catastrophization and avoidance beliefs and fears and behaviors that people often get stuck in. And so there's kind of different phases or stages that they take this through. At least this is my understanding of it. Again, I'm not incredibly well versed on these topics, but this is what I have believed to be the kind of the stages that they'll go through based on the literature I've looked at. So is the number one is the therapist or individual you're working with is going to give you these kind of graded homework assignments, going to start to kind of have you take action against this. And then as they do that, they will also kind of start to put in the component of what we call cognitive restructuring. So basically what it sounds like, helping you to kind of evaluate and look at your thoughts and even your actions a bit differently. And then they're going to give you what we call relaxation training. The specifics, I don't know how that would play out, but basically helping you to stay emotionally calm, which will help you better process and analyze how you're feeling and the steps that you can take in those moments. And then they'll give you time-based activity pacing. All right, so just another strategy that they're going to use that builds on these other three components that's done in a way to be very, very helpful for, again, getting rid of this kind of pain catastrophization and kind of these fears that kind of cause us to avoid and limit, our actions that we need to be taking with our movement. And then that kind of final stage is basically going to be extinguishing the pain behaviors. So 5 steps that oftentimes take place, from what I understand, with cognitive behavioral therapy to help people get their life back on track. And so it's been shown in some of the research I was looking at that cognitive behavioral therapy yields long-term improvements in a number of ways. So pain intensity, right? Our kind of nervous system, our emotional nervous system, and our kind of central nervous system just starts to unwind a bit and kind of cools off, and that drops the intensity of our pain. Again, as we start to recalibrate our thinking, it improves our disability, right? So we feel a little more empowered to realize that, hey, I actually have more tolerance to do some of these activities and tasks that I've been avoiding. It's also going to make improvements with pain-related coping, right? So you're going to actually have better coping strategies for dealing with the troubling thoughts and the things that have been limiting you with doing more of the physical tasks and activities that you've been avoiding. Naturally, it'll help with depressed mood. Feel like you're getting your life back. This pain is not bullying you around. It's not stripping everything out of your life that you want to get back. And so less depressive mood. Quality of life, therefore, increases. They found that quite notably in some of the research, which makes sense. You're getting your life back. You're feeling more empowered. Pain is no longer the big bad bully that's kind of got you backed up into a corner. You're not in that situation anymore. So quality of life is better. And then your healthcare seeking behaviors improve as well too. And I think that just comes from better interpreting and understanding our own thought processes and being able to realize how we're thinking and what can be done about that. So pretty powerful effects that they found with cognitive behavioral therapy. And again, that just comes from an article by Houghton in July 2016. The article is called Chronic Pain and Mental Health Disorders, Shared Neural Mechanisms, Epidemiology and Treatment. So that was the name of the article if anyone was interested. So then when it comes to optimizing outcomes from physical pain and injuries, there's some considerations to make when dealing with injury. Again, this is kind of tying into some of the stuff that we've talked about throughout the episode here, but really just want to ground you with some things to consider and actions to take. So the first one is, again, leave space for the emotional aspect involved with your physical recovery, because you're only human. I'm only human. We all have breaking points and things challenge us in our own unique ways. So if you've been injured, then absolutely devote time to working on your physical recovery, but also make sure to devote time to work on your mental recovery as well. So kind of multimodal recovery, not just physical, but also mental and even spiritual as well, right? These are all important things to consider. And then the third one to consider for optimizing your outcome for your recovery is to adopt the belief that your recovery matters, because it absolutely does. I think that's a very powerful just kind of mindset that we need to frame ourselves or our situation in and ground ourselves in, is that your recovery absolutely does matter. And why it matters, well, I mean, we could open up another podcast on that, which I'm going to. One of the reasons why it matters is because you can frame it up as becoming what we call a wounded healer. So someone that uses their own struggles and challenges that they've gone through to then give power and life into people who are going through what you've already gone through. So we'll get into that in another episode. So your recovery matters. Why you choose to believe it matters, you get to pick. But I would say you absolutely need to believe that your recovery physically, mentally, emotionally, socially, spiritually, it matters. Also, you need to know that all of this can be a process. It takes consistent time and effort, but it will pay off. So don't lose heart. Recovery is seldom, if at all, ever linear. There's lots of ups and downs. Okay, so it's going to be a process. In the clinic, I find the people that do the best are the ones who are able to accept that and then still say, okay, well, here we go. Let's rock and roll. Let's take it a day at a time. There'll be good and bad, but as time goes on, if I put in the work and effort and I don't give up, the good days will become more frequent and the bad days will become fewer and further between. And when a bad day shows up, it won't be as bad and the good days will keep getting better and better. But this is absolutely going to be a process. Now, another one for optimizing your outcomes is to remember that going through this, it makes you uniquely qualified to speak life into others who will one day go through your experiencing. I just mentioned that a minute ago. That's the wounded healer concept, but it's super important. So I just really want to hammer that home, that you will be uniquely qualified to help others who one day find themselves in the situation that you've gone through or a situation that you're currently in. And we can use that for our good if we choose to do so. So lots of ups and downs along the way. It's rarely a linear process. I said that a minute ago. But with this last point here, I want you to give yourself some grace through the troubling and challenging days. It's not to say they won't happen. They will. You don't give up, obviously, but give yourself some grace. This is not easy stuff to go through when you're getting out of pain and you now have mental health components that need to factor in and be addressed. So give yourself grace. I think that's an important one. Okay. So if you got something helpful out of this podcast, please consider leaving a review. That would mean the world to me. If you don't know me and you've made it this far, I mean, that means the world to me. I'm a solo content creator, and what I do with these podcasts, the blogs on my website, the YouTube videos, Instagram stuff, I do it all myself. I don't have the funds to hire a team at this point. Maybe one day if things take off well enough, but I think if you get anything valuable out of this, please consider leaving a review. That would absolutely mean the world to me. And if you feel like any of the topics or concepts discussed in this episode or other episodes could benefit others whom you know, feel free to share it with them. Not because this is all about me, but because this is all about trying to help others out. And if you feel it's worth spreading the word, that'd be wonderful. So we're going to end it like I often do on my YouTube videos, and now how I also end it on these podcast episodes. I hope, again, you guys are all doing well out there. And here's how I'm going to end it. Keep looking after yourselves. Keep looking after one another. Keep making great things happen. And I will see you in the next episode.